So let's talk about what midwives do and what they don't do versus a doctor. Do midwives run any tests or monitor anything during pregnancy or labor? Does anybody know that one? Liz?
My midwives did do glucose tests. They did both do Group B strep tests. My midwife at one point in my pregnancy, when I was sick, ran a CBC and was able to send it into the lab and bring it back. But when it came back, she didn't know how to read it. So she was like, I'm not sure what this means, so we need to go into the hospital. That was a week before I gave birth. I was sick. I had like a UTI or something, and I had to go in. But because she was like, I don't like this CBC and I don't know what it means. So she did in that instance, she was able to, take me in to do like an ultrasound. I had to go into, there was like a perinatologist that would take home birth patients for their 20-week ultrasound. So she was midwife friendly. And so I was able to get an ultrasound that I paid for that way. I know not all midwives do that many tests, for sure, but mine did, and I wanted all those tests, so that was a requirement going into it. But I knew that there were midwives that didn't like no tests, and I was like, whoa, that's crazy. But even the tests I got weren't enough. She didn't do enough. Let's say that.
Well, mine, let's see, every time I went to an appointment, I peed in a cup, just like you would at the doctor's office, and had the little strip thing. I thought I had a nurse midwife because I thought she knew a bunch of stuff. By the way, she had the bed where you would go, like just like being at the hospital or the doctor's office. So she was checking all my stuff. She offered me glucose. I did that. I did do the strep. I did everything. Like if there was a test to be offered, I'll do it all because I wanted to make sure everything was good. So of course she offered me whatever. She even had on the outside of her door was a lab box where she would put her stuff in and they would come and pick it up. I'm not totally sure how legit that is. I'm not totally sure. I don't know how that works. I don't know much about it. But I did find out later that she actually didn't have a license to have a business in my state. So her even having an advertisement of her business anywhere is actually illegal, because that was one of the only things that I could actually turn her in. Was I did call the state to verify and see if she had a license for her business, because she has a business. She did not. And so they told her everything, the sign on your door, anything, whatever, has to be taken down. And that was the only thing I could do to her, was that she couldn't advertise. She couldn't have a website. She couldn't be on anywhere because it's actually illegal in my state. You have to have a business license, and she didn't have one. So I'm not totally sure how legit that box was on the outside. If it was to look like she's taking lab stuff and it's going somewhere and somebody's picking it up, or did she trick the system? Because there seemed to be some interesting things when I went and did ultrasounds, almost like a sign off like a doctor. So I'm not really sure, to be honest. And she did, when we did ultrasounds, her and the guy would be talking like as if she could read and understand what was going on with the ultrasounds. So again, another lie basically was that I thought that she knew more than she did. But yes, I did same thing. Like I noticed, like just do whatever. I didn't get to the whole labor part, but I do hear of a lot of women, for when they're actually monitoring labor, they're using a Doppler. And Dopplers are like the big thing of being checked. So let's go in further of that, because I want people to understand what a Doppler is and understand the whole thing about a Doppler, because I didn't understand. I was given a Doppler to take home at the final hours of my son's life, and I did not know how to use the Doppler. I don't know whatever. And honestly, I don't know if she even really knew how to use the Doppler. You can buy a Doppler on Amazon. So I'm very curious of what you guys have to say about the Doppler thing, because again, it's something that I didn't know, but I do know a lot of them do have the little handheld Doppler thing. And I wonder, do they know how to use it like properly?
Well, it doesn't give you anywhere near as much information as like continuous fetal monitoring, of course, because what they're looking for with continuous fetal monitoring, I learned later, is not that the heart rate's not low. They're looking for, variability. They're looking for recovery after contractions and how D cells, and if they recover quickly. they're looking for, you know, a normal activity pattern, which you can't get from intermittent monitoring, which is what a Doppler does. But concerning my birth, my baby had a heart rate in the 180s for, you know, a couple hours before we transferred. And so her heart rate wasn't low. She wasn't having D cells until the midwife's like, oh, this is weird, but it's probably just because you're hot, because you were in a hot bath. So, and 180s is, that's like tachycardia. That's like a heart attack for a baby after hours of that. It's just that baby's hearts can't do that. So high was bad too, but she was like, and right, the last heart rate she took before we walked outside was it was like 160 something. She's like, oh good, it came down. Well, her heart rate was crashing because she was born a few minutes later with no heart rate and dead. And it's like she was like, oh good. And it's like, that's why she was so shocked when she came out not breathing, because she was like, but the heart rate went down to normal. Like, it's like, how do you not know that? Any OB I've told this to, or nurse, is just like their face, because they're just like, how is she so stupid? And even the board asked her, they were like, did you take a pulse or blood pressure on the mom? Did you take pulses and blood pressures on the mom when you arrived, when she was in labor? And they were, because we don't see it in the chart. She's like, well, no. And she's like, why not? Well, I mean, she was doing great. And I just like, they're like, how did you not take they were even mad at her. These are her friends. They're like, how did you not take her pulse and her blood pressure when you showed up? It's like, the mom has a fever, the baby's heart rate's in the 180s, and you don't check the mom's pulse or her blood pressure? Like, what were you there for? What were you doing?
It was hands off.
Mm-hmm. Hands off, totally.
Hands off. Does it well, and it doesn't sound like she would know what to do with the information anyhow. So in a way,
correct.
It was ignorant and incompetent. So
Yes.
Could speak to, I wanted to speak to like, I can kind of combine the last couple of questions, both the one around the midwife and what tests they run, and the Doppler piece. I can kind of combine it all together, because actually, so my first pregnancy was overseen by an OBGYN practice, and my second one was by a certified nurse midwife practice. But I can speak to the fact that that's why that certified nurse midwife credential is so separate from the CPMs and lay midwifery, because really in my two pregnancies, even though the model of care was somewhat different, the testing was identical. So in both my OB and certified nurse midwifery practice, they oversaw my pregnancy identical. I had ultrasounds at the same time. I had the glucose testing at the same time. I had towards the end of I had group B strep testing for my second pregnancy with the midwifery practice. I had group B strep positive. So I had a course of antibiotics during labor and had that whole protocol through IV antibiotics. And both of my babies were delivered at 40 weeks, 5 days. It just kind of happened that way. And after 40 weeks, I had like my 40-week checkup with the midwives. And I did just say, I was kind of like, you know, it's probably nothing, but I just feel him move a little less than normal. And they said, you know what, but we're going to just check it out. So they had me go right in and get a non-stress test. So they were very, very evidence-based in how they did my care. And I had continuous fetal monitoring in the hospital the whole time. So that brings me to oftentimes when I was in VBAC groups or home birth, when I would hear about that in groups, people would talk a lot about like, well, all you really need is just Doppler checks, particularly for women doing a trial of labor. Well, you just need the Doppler checks. You just need this, but it's exactly what Liz was saying. No, that's not what they're looking for. And my uterine rupture during my trial of labor was largely detected from the very things Liz was just talking about, you know, the heart rate D cells and then not recovering, and then it being kind of all over the place, and ultimately then really a serious D cell where it really crashed. So yeah, that speaks volumes that oftentimes the information they're getting on a Doppler is not really going to give you the information you need for quality care. And it's not going to, you know, have that pattern of what's actually happening to your baby inside of you.
Right. Is it better than nothing? Yes, but we used to have like these horns that doctors had to listen on their stomach, and it's like that was better than nothing. Doppler was better than that. But I mean, we live in 2020, so I'd like to get, the best and not like use a horn on my stomach to make sure the baby's okay. I'd like to go with the most advanced evidence-based choice, which is continuous fetal monitoring. Even when I had him at the hospital, they were like, well, do you want us to take it off when you go in the water? And I was like, no. I said, can it go in the water? And they said yes. And I said, then I want them to stay on, because why would I take them off? Like, I've had bad things happen. I'm like, no, I would like to know the whole time that he's okay.
Yes,
See,
exactly. And one thing I'll add too is when I was in my third trimester with my son, the midwife that saw me for one of my routine appointments, she talked about what a trial of labor would look like. And she just said, we do have rules that we follow with it, and it's important. She said it's actually, so she even said it's really unlikely that your uterus will rupture or anything like that will happen. But in the event that it does, she said, we always have you have an IV placed when you get to the hospital. She said, you don't have to have an epidural. I mean, I did get one, but she said, yes, please. But she did say, you don't have to have one, but we do place an IV just because if something were to happen, she said, when things do go bad, they happen quickly. So she said, we don't have time to mess around. So she said, we have those things. She said, at the hospital I delivered at did have tubs. You could labor in them. They're not for water births, but you could labor in them. She said, each room has a tub or a shower. She said, if you are thinking of using those, or if you want to walk around during labor, I can get you the fetal monitoring that you can move with. But she said, you have to keep it on. We have to be able to track all of those things. She said, we're not going to let you go super post date. We're going to check in after 40 weeks and we're not, and she talked about all of those things. If you're now in my labor, and this does vary, I did have Pitocin, but she said if we give Pitocin, it's not going to be to start labor. She said it'll only be to augment labor, and it will be very specifically given to specific criteria that we follow. So that are just vastly different from now. And I did end up having the thing that doesn't happen a lot, or it's presented as not happening a lot, but it did happen to me. But I had a somewhat different outcome. My son still had a hypoxic brain injury, which when you look at the statistics, I believe is still 6% of babies uterine rupture that will happen if they're born in a hospital. But so anyways.
And that was with care, like with a C-section right there and everybody right there. What would have happened if you were at home?